Hey everyone, welcome to the show. I'm your host, Dr. Joseph Kappas, and today I'm lucky to be joined by my guest, Dr. Frank Patterson, down from Inova Brain Center in Atlanta. Thanks for joining me today, Dr. Patterson.
Thanks for having me. I
Yeah.
appreciate it.
Things going okay down there in Atlanta? It's probably nice and sunny.
Yeah, we're surviving.
Yeah.
You know, we're amidst the craziness like everybody else, but fortunately, Georgia is not at the top of the list as far as, cases of all this stuff going on. So we're very fortunate in that regard. But.
Yeah, very fortunate. Yeah. So, Dr. Patterson, you wanted to come on today to talk about sensory processing disorder. And before we jump headfirst into that, can you tell us a little bit about who you are and what got you so interested in, the field of neurology and sensory processing disorder?
Cool. I'll try to give you the short version, but yeah, I was always interested in healthcare, and I didn't really know where I fit into it. And then I started having ankle issues, and I went to see a chiropractor. And my ankle issues got better, and some other things got better as well. I had better energy levels, and I wasn't getting sick as often. And then I decided, hey, maybe my place in healthcare is as a chiropractor. And then I went to chiropractic school, and then from there, I discovered the whole neurology side of chiropractic. Chiropractic neurology or functional neurology, whatever you want to call it. And I got heavily involved with the neurology club when I was in chiropractic school. And then I was very fortunate to be in the right place at the right time, just as I think Dr. Druzwicki had described in one of your previous podcasts. And I got to work with Dr. Carrick and be one of his interns when he was doing patient rounds. So that's when I really got sucked in. And then I kind of fell in love with neurology. And as far as working with kids, like I've always really enjoyed working with kids. My mom, my entire life, including when I was in college and in chiropractic school, told me I should be a teacher. We have differing opinions as far as what I should be doing with my life, I guess. My mom was always very supportive of me working with kids. And to be honest with you, when I was a kid in school, I had some of my own troubles, both academically and even arguably with some sensory processing issues. So it's very near and dear to me because I know what it's like. So.
Okay, very interesting. Well, I know they always told us in school, doctor means teacher, right? So you kind of satisfied that, right?
Yeah. And I love talking about this stuff as you do, and I think a bunch of people on your team do. And educating our patients is a big part of our jobs. So.
Absolutely. So for those who aren't familiar with sensory processing disorder, what is it and who is typically affected by it?
Yeah, so sensory processing disorder, or SPD, and I'll probably use the term SPD a lot to try and save some time, and so I don't have to drink as much water. But sensory processing disorder, typically we're thinking of little kids that have issues where they get into a sensory-rich environment, so they might get in like a busy, loud environment. And then it gets to the point where it's kind of too much for them to handle. But it's interesting because you can make the argument that any of the patients that I work with, and I'd argue the same for the patients that you guys are working with because you're doing similar work, have issues with processing sensations. And it can lead to big deficits in functionality outside of, say like light sensitivity and sound sensitivity, which is pretty easy to conceptualize. It can lead to other symptoms that people didn't even realize that it's connected. So, but in that realm of sensory processing disorder, we're thinking of kids, right? It's a developmental issue. You may get a concussion and then you develop issues with sensory processing, but to have sensory processing disorder, you're typically a child, okay, when you're first diagnosed. So, although some people are diagnosed later in life, but we're typically looking at children. And it's interesting. It could be considered to fit in the realm of like neurodevelopmental disorders, like things like ADHD and autism. But the way that it's evaluated is somewhat fairly unique, and it's a good thing, and it's a little bit of a tough thing because autism and ADHD were founded in the psychology realm, whereas sensory processing disorder was first, the theory was first developed in the 1970s in occupational therapy. So there's a little bit of tension, I think, between maybe you could say the occupational therapy community and the psychology community, which has more traditionally been involved with neurodevelopmental disorders.
Absolutely. Yeah, that's interesting. I didn't know that. How would a parent maybe pick up on the early symptoms or warning signs that their child may be having issues with this?
Yeah, so with a lot of things with neurodevelopmental disorders, you're looking at observations, right? When we first observe that maybe our kid has some attention issues, you're seeing it as the parent, or maybe it comes from somebody in a school setting. So you can see in your kids, there's kind of different categories, like subcategories of sensory processing disorder. Stereotypically, the big two are kids that get overstimulated, right? You get them in a loud, busy environment like a shopping mall or something like that, with bright lights, a lot of smells, a lot of movement going on, and then they can't handle it, right? And then they may freak out or have a meltdown, but it may seemingly come out of nowhere, right? Or then you have the kids that kind of crave sensation, right? So that may be the kid that runs around and you think he's running around like a nut, right? But he just needs that stimulation from movement, right? Both from his joints and muscles and maybe some of that inner-ear vestibular input that maybe we'll talk about a little bit later more in depth. But those are kind of the stereotypical categories. There's other subcategories, but maybe to start out, we'll kind of just think of those two, understimulated or overstimulated. But if you're looking at the overstimulated population, right, you may be able to confuse them with people that have other issues, right? If you get overstimulated, you may think of, somebody that's on the autism spectrum, right? You can have sensory processing disorder and autism, or you can just have sensory processing disorder without autism, and that makes it confusing. So that can complicate the diagnostic aspect of it. And then with the understimulation side, if you got a kid that needs physical activity to kind of calm their brain down, they're probably not going to have great attention. So then you may think that the kid has ADHD, but it may be more of how they process their sensations. And it looks like ADHD or ADD, but it's not really necessarily the same thing. And it's tough because you can have more than one thing going on. You could have sensory processing disorder, and you could have ADHD or sensory processing or disorder and autism.
Absolutely. Absolutely. It seems like with most neurodevelopmental disorders, there seems to be an increase in them. At least that's what the research tells us. What are some of the factors that are going on in our world and environment that might be, predisposing more and more people to suffer from SPD and other types of neurodevelopmental disorders?
Yeah, so when you're looking in the neurodevelopmental disorder realm, there's a lot of theories out there, and the true answer right now is we don't know. That's the simple answer, is we don't know. But most likely, based on the research, there's some genetic factors, there's some environmental factors, right? Both in, say, increase in things like tablets and technology, and how that has an effect on the brain. And with those tablets and technology, it's leading to a more sedentary lifestyle. So there's those lifestyle factors, but then there's also genetics. And if you have parents that maybe are a little bit, arguably on the autism spectrum or kind of on the periphery, and then you put them together and then you put their genetic makeup together, then you are more likely to have a kid that may be a little bit more severe on that spectrum, right? Or you may have an adult that has some sensory processing issues, right? And then their child may have some sensory processing issues as well. So we don't know, but there's likely some environmental factors going on, and then there's likely some genetic factors going on. And then there's some, psychological and behavioral things going on as well, and life experiences that can feed in here. So it's, unfortunately, there's no real one answer, but the truthful answer is that we don't know for sure.
And then when dealing with these patients, I mean, we know that there's typically an issue in the brain. What causes that, we're not sure. You had mentioned the vestibular system a little earlier. What are some other regions of the brain or common culprits, I guess, that you typically see in these patients?
So with kids with sensory processing issues, like the standardized assessment is kind of looking at things at a systems level, right? So you're looking at how basically you introduce a movement or a stimulus and then you see how the person reacts to it. So introduce some smells, right? They'll challenge for the vestibular system, they'll challenge your balance. Okay. They'll also look at the visual system, right? Both visual acuity, but you also want to look at movements of the eyes. So if anybody stumbled upon this, right, and maybe they're in the post-concussion realm, and you guys have kind of maybe gotten a little bit of notoriety with this, with the podcast and some of the blog posts you're doing, like some of this may sound familiar, right? It's very similar to people with post-concussion syndrome in the sense that multiple areas can be involved, and there aren't necessarily stereotypical areas. And this is in the realm of sensory processing disorder, but also in the realm of autism as well. There's a commonality in that, like we've got those two major categories of understimulated versus overstimulated, right? But as far as which areas of the brain are directly involved in there, it's tough to say. Some areas that do tend to be involved, though, we'll see some cerebellar deficits, right? Your cerebellum is involved with coordinating movements and thought, right? We typically see deficits in that area of the brain, some frontal deficits as well, right? Your frontal lobes are involved with cognition, impulse control, right? And you're going to see that especially with the ADHD population, kids or adults that are dealing with ADHD, right? Their frontal lobes, certain areas may be pretty intact, but there's a lot of real estate in there. And as far as like being able to maintain focus and impulse control, those areas of the frontal lobes may not be working out so hot, right? And you could have some of that too in somebody with sensory processing disorder. So the biggest thing is you want to look at the brain as a whole, and then you want to test areas individually as best you can. But what's more realistic is you're going to test them as networks, and that's arguably kind of what makes functional neurology unique. Is that as functional neurologists, we're really good at testing networks or groups of areas of the brain working together. Whereas typically, especially in the sensory processing disorder realm, things are looked at more at a systems level. Oh, you have a vestibular deficit, right? Or you have a processing deficit with hearing, taste, touch. You have a proprioceptive deficit, which is kind of joint position sensing. Where is our hand in the world and space, right? You have deficits in that. But it's important to know which areas of the brain work together as teams, creating a network that allow for good vestibular processing or allow for good proprioceptive processing. Absolutely. So it can be a challenge. There's no, one area. It'd be real nice if there was, but there's a lot, and you have to look at each individual's unique brain network needs.
Very true. And down in at Inova in Atlanta, you guys have a fantastic clinic, and your exams are pretty top notch. Can you kind of run through how your exam process goes, and what somebody could expect coming into your clinic that may have this?
Yeah, fortunately, I think it's arguably probably pretty similar to your process, which is great because we're not the one unique center down here in the South that is best suited to address this issue. There's a lot of us professionals in the functional neurology realm that can provide some help in these areas. But we're looking at essentially a sensory and movement based analysis, right? To look at how sensations are processed in the brain, and then how that creates some kind of movement or some kind of reaction to that sensation. So we're going to do our thorough neurological and physical examination, which you guys are doing as well. We're going to track the movements of eyes. It's a little bit challenging with kids, right? Because they may not wear the goggles that we put on an adult that has like post-concussion syndrome. Some kids are up for it, some aren't. We're going to do the recordings if we can. If not, I can do it bedside, and I can hold up a toy or something interesting and try and get them to track it. It's great to get those recordings because I can show it to the parents, but as best I can, I'll show it to the parents bedside. So eye movements. We're also looking, with kids with SPD. A lot of them have challenges as far as with balance. So we're gonna do a thorough balance assessment as well, because you can't have good brain function without having good balance, and vice versa. And we're going to do that formally with computerized dynamic posturography, but that necessitates that somebody stand on a pad for 25 seconds.
Mm-hmm.
So a younger kid, they're probably not going to do that. You know, if I pulled an average kid off the street that's like 5 years old, they're probably not going to be down for that. But we can do our best to assess that in a dynamic function, excuse me, as well. So we're going to look at different areas of the brain and the different jobs that they're supposed to do. Excuse me. And then systematically say, hey, can you do this job? And then if the reaction is appropriate, then we know those areas of the brain or those networks in the brain are reacting appropriately and are probably working appropriately. So we move on to the next network or next region of the brain and test that.
Mm-hmm. Very good. And I mean, you mentioned a subclass of these SPD patients are more prone to be overwhelmed. What are some steps that you as a clinician and maybe other clinicians that might want to work with this population, what are some steps they should take to prepare their clinic, and maybe ways that they can think outside the box when treating these patients?
Yeah. So, you need to look at the individual. So if it's somebody that craves sensory stimulation, then you probably want a rich sensory environment, right? So that's typically what you're going to see in an occupational therapist's office, excuse me, that works with this population. They're going to be, there's going to be a bunch of foam pads everywhere. They're probably going to have balance beams. They're going to have swings that the kids can swing on. But then on the sensory sensitivity side of things, like you're going to want to look at the lighting that you have in your office. You're going to want to look at how much stuff is in the room. If you got a kid that's prone to being overwhelmed, then you're probably going to want less in the room. So it's not visually as stimulating as well. It's not unlike, I've said it before, working with post-concussion patients. Like some of those patients, they get overwhelmed as far as sensory processing, and you can't have complex patterns, right? Because it'll throw them off. Usually, we see a little bit less of that with kids that have sensory overprocessing issues, but it still needs to be taken into consideration. So we'll kind of try and change up the environment based on the kid that we're working with. Whether we bring more stuff into the room, increase the lighting, or we have more gentle lighting and we have less things in the room. So you really want to get some feedback from the parents first and find out, what do they like in the grocery store? What do they like at home? What do they like with grandma and grandpa at their house where maybe there's less toys to play with? Are they cool? They're pretty chill with it? Or are they going out of their minds because they get super bored super quick, right? And they need some kind of stimulation.
Very good. Yeah, that's great. And then, Dr. Duffy,
Sometimes we're synonymous.
Yeah. Dr. Patterson, how does your therapy differ from maybe the standard care that people typically get? How does it complement it and whatnot?
When you're working with a chiropractic neurologist or functional neurologist, the therapies that we provide, it's definitely complementary to what's out there. I typically like to work with kids about age 6 up. It's not to say that I couldn't help sooner, but a lot of times with the younger kids especially, I prefer that they work with an OT first, and they also explore kind of the nutritional realm as well, because that can play a factor. But where we differ a little bit from an OT, why you should see us in addition to the OT, is that once again, we talked about kind of the diagnosis standpoint, where the more traditional diagnosis in SPD is kind of more at a systems level, whereas we're more at an individual brain and networks or groups of areas of the brain working together. And you see that as well with our therapies. A lot of times they'll see vestibular deficits, say, and they'll be like, all right, your kid should swing. And swinging can be great, but as I'm sure you've seen in your clinic, swinging or rotating, can stimulating that vestibular system can be a powerful influence on the brain, but you want to do it in the right direction.
Right.
And so we're very specific in which direction for what period of time we're going to do that rotation in. Whereas sometimes it's more, let's let's just get that overall global vestibular stimulation. But we know that there's a vestibular apparatus in our right ear, right, and our left ear, and they're not always in balance, right? So if you boost the whole system, you're just going to perseverate that imbalance, right? So maybe we want to rotate a kid to the right versus the left, and we've seen it where some of the indicators of how well the brain is functioning, we rotate them to the right, and those indicators get better. We're like, yes, we're on track. We rotate them to the left, and they get worse. So if we just let the kid kind of do what they're going to do, you know, maybe they'll get more right rotations in there, but let's be specific about it, right? We'll try and get the best results possible as quick as possible. So we're a little bit more specific in activating those networks in the brain to try and yield a little bit more specific results. But that being said, when you're dealing with somebody under the age of 6, right? I say 6 because you got a little bit more volitional control there. We got some kids that are a little bit more prone to, you know, doing what you want to do and playing the game with you, whereas younger kids kind of want to do their thing. And with that, coaxing and getting that kind of more general stimulation is usually more beneficial, and it's a more realistic environment for them to work in. It's a little bit tougher to expect, you know, a high level of specificity in volitional activities, or, you know, activities that kid is, you know, going to respond and want to participate in, unless they're, you know, say 6 years and above. That being said, like, I still like my patients, you know, continuing their work with occupational therapy if the occupational therapists think it's warranted. It's just we're going to add on a whole other level of specificity there that you may not get somewhere else.
Absolutely. And it sounds like there's so much variation and such a spectrum of where these patients can fall on, you know, as far as how severe and specific needs each particular patient needs. So that specificity that you offer sounds incredibly important for these cases. You had mentioned nutrition a little earlier.
Yeah.
So backtracking to that, how important is nutrition and diet in these patients and other neurodevelopmental disorders?
It's typically very important, right? I'd love to say that, you know, just getting a kid to eat is the most important thing. And honestly, in some cases it is. You know, you just got to get them to eat. Maybe they're just not up to eat. But, you know, for the most part, we want to get them eating the right things. It's not a huge focus of my practice, but it's something that's becoming increasingly more and more important in my practice. I know you guys are fortunate in your practice that you have some good functional medicine doctors, in addition to people that are well-versed in functional neurology. So a lot of times if we're to go really in depth with where we're at right now, I'll usually make sure that there's a functional nutrition specialist involved in the scenario as well. But it's really important to make sure that we're getting the correct fuel, right? And then we're not going to be consuming things that are going to irritate our nervous system and just kind of make the situation worse. Because we can do all the right therapies, but if you're constantly eating things that are going to irritate the function of the brain, it's going to be a losing battle, right? And the gut is definitely going to be a factor in here. So we do some nutritional counseling with people we're working with, but if it seems like it's going to be a real complex case or scenario, then we're going to bring in somebody that does functional nutrition as well.
Yeah. And it's hard to give general advice, especially when it comes to nutrition, but are there things that, I mean, kids are, you know, you're eating mac and cheese and everything full of sugar and carbs, and like, what are some of the things people should maybe try to take out and maybe replace with something better, I guess?
Yeah, I mean, I think you hit on some right there. You know, it's the kind of the common knowledge that we've known, a lot of it, not all of it, but a lot of it's the common knowledge that we've known for a long time, right? You want to stay away from processed foods, right? You want to eat whole foods. You want to eat, you know, primarily a plant-based and meat-based diet with complex carbohydrates. You know, if you're going to get your carbohydrates, maybe from like a sweet potato or a potato, not from, you know, ideally not from mac and cheese, right? Gluten-free is great, but even still, like gluten-free mac and cheese is not necessarily the way to go either, right? You want to eat foods that are low in grains typically, and high in fruits, vegetables, and more whole foods, and some meat in there as well, a good protein source. Yeah. So that's some good general guidelines, and juice is not always necessarily a good thing, and soda, definitely try and stay away from it. So.
Yeah, I would say those are probably two easy things that maybe
be a good place to start. Things that we should all be doing, and probably some good conversations that you guys and we're having with our post-concussion patients as well.
Absolutely.
Nutrition is going to have an impact if you've had a brain injury as well.
Yeah, I mean, a lot of this stuff definitely overlaps with that population.
Yeah.
As well. But Dr. Patterson, we are just about out of time. So I wanted to make sure that we had enough time at the end for you to leave us with any final words or thoughts, maybe something we didn't get to.
There's kind of some closing things that I had written down to make sure that we hit. We want to look at the behaviors of these kids, right? Because ultimately that's what's going to lead us down that path as we notice behavior in our children. But we want to look at these behaviors through the lens of how the brain could be at play here, right? And that being said as well, though, we want to take the behavior into consideration, right? You can't just dismiss behaviors and say, oh, it's just their brain not working properly. So you gotta do the dance, and you gotta address the behavior, and you gotta address the neurological function in these kids, and don't just look at, the perceived weaknesses in these kids, or what they struggle with. You got to look at these kids and what their strengths are and reinforce their strengths, because it's really important not only for a self-esteem benefit, but for just a developmental benefit as well. And we all have strengths and weaknesses, and remember that. And anybody that suspects that their kid has sensory processing disorder or is in the middle of this journey, the sad truth, but the truth is you and your child are going to be misunderstood, right? But the only way that we can combat that is to educate yourself, right? So that you can better educate your child, and you can better educate those around you, so that people understand better what's going on, so that they realize, why these behaviors are coming up, right? So you gotta, and I guess in closing, you gotta build your team, right? And your team is probably gonna be an occupational therapist. They should definitely be in there. There may be some speech. There should be a psychologist or some kind of counselor, right? Or somebody that can work at the behavioral aspect of this, right? But there should also be someone that's looking heavily at the neurology. And that's where a functional neurologist can come in, because we're specialists, as I said before, in that sensory and movement evaluation and therapy and how it pertains to the brain, right? At a very, very high level. And you know what? Some nutrition in there as well. So I'm glad you brought that up. So some nutrition should probably be on your team. It's going to be a team effort. No one provider is going to be able to give you all the answers. If you're fortunate, you can find a group that all works together, and maybe they're in one building, right? But you may have to go to a couple different buildings to build that team.
Yeah, very good. And if people wanted to find out more about you and your clinic and adding you to their team, how would they go about doing that?
Yeah, so you can go to innovabrain.com. That's our website, or you can look up Innova Brain Rehabilitation or Innova Brain Rehab on Facebook. And then my Instagram is up.your.brain on Instagram. You're going to have to excuse me. I'm a little bit new to Instagram, so I don't have that many posts yet, but I'll most likely be posting more in the future, probably more on this topic, especially because, like I said, it's something that's near and dear to me, with some personal experience in there. And I'll probably share that a little bit more in the future.
Yeah.
My personal experience. So.
Very good. That'd be a great resource for other folks dealing with it. But thank you, Dr. Patterson, for taking time out of your day to come on and educate us on this topic that you're so passionate about. I think a lot of people are going to take a lot away from this one. I think, this is really
excellent.
Good.
Yeah, thank you for the opportunity, and thank you for the work that you guys are doing in Chicago and beyond, right?
And beyond, eventually, maybe. But yeah, it was good talking with you.
Good speaking with you too. Thanks, Dr. Kappas.
Yep. This has been your host. Be well.